Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shalender, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 AM, radio that listens to you. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchakarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchakarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
Hi folks, this is Dr. Virender Sodhi, and today is Saturday, and as you know, this is your favorite show, Your Body is Your Natural Pharmacy. I am speaking here from Phoenix, the hot Arizona. The temperature outside is 105 degree Fahrenheit, and which is too much hot for me because living in Seattle for almost 30 plus years, I'm not used to that much heat. And also I'm born and raised in the mountains of Himalaya, so my system is kind of not very conducive to the heat. But we have this wonderful the naturopathic convention here, and there is around almost 1,000 doctors in this conference, and we had wonderful lectures, and I also delivered lecture, talked to folks about what I do, and I have some good insights into learned some new things this year again, and this is all about the convention. You go, you teach, you learn, and you grow, and so I'm very thankful for that. Today's topic is about travel. As you know, summer is here, and last time we talked about what we should do in the summer. So related to the same kind of topic, travel is very common when we are in summer because kids has vacations and we all have plans to travel. And travel is fun. I love traveling myself too. And my father was in education back in India, and he was principal of schools, and every 3 to 4 years he got to a new place. So that was another different, interesting experience in traveling to new places. So we end up actually traveling all over Himachal Pradesh, which is a small state in the north part of India, a mountainous state, a Himalayan state, very, very beautiful. So the travel is fun, but it also comes with its own side effects and the anxiety is one. So whenever you're trying to go somewhere, there is anxiety related to it, to the place where you're going to see an unseen place before, what is going to happen there, or what is new there. There's excitement, and you want to do some sightseeing, and then at the same time, you don't know what is the train, what kind of people are there, are you going to have a good experience or bad experience. So that anxiety is very natural. So one thing which I encourage people to do is make a list. What kind of stuff you need to take on your trip. It's from even as small as shaving kit to toothbrush to hair combing stuff to all your shoes, what kind of shoes you need to, because make sure that you have a nice shoe, because if you're walking out there and you have a very fancy kind of shoe, that may not work. So make sure that you have a very comfortable clothing, and according to the season where you're going, is it hot or cold? Depending upon that, make your choice of your clothing. Make sure that you have protective glasses and you have a hat. These are a simple things which you need to make sure that you have in your possession when you're traveling. Then on top of it, you want to make sure that you have travel documents like your passport, and his passport should not be expired. We have a few family friends and they have gone to the airport and just to realize that, oh my God, the passport was expired 6 months ago. They didn't even look at it. So make sure that you do that, and you kind of unnecessary hassle you can avoid by just looking at these documents, preparing before you go even. And also then the visa requirement, different countries have different visa requirement, and make sure you ask your travel agent what are kind of visa you need and what you need to do for that. And you should have all those aligned up before you go for travel. And then this we had some interesting incident this year when we went to Mexico. My wife picked up the old passport, and so make sure that you pick up the new passport, which is valid. So sometimes you have good attention, you have all the things you thought you put in there, but you took the wrong document, and that can create its own problem. So basically, my son Guni is very organized, and he has a list he makes before you have travel. You can make that list and keep in your computer or in your cell phone. So next time you don't have to do it. And once you get all those documents, all those things, all your clothing, all your shoes, all the things which you want to carry there, uh, and then check them. So, okay, you've done that, done that. Now you are satisfied and calmer. So very important to do this, because this will cut your anxiety to bare minimum. Yes, there will be still anxiety of the unknown, going to new places, what's going to happen there. Uh, these days, there are a lot of travel guides and there are agencies, and so it's not a bad idea to go through a travel agency who has done it, and rather than you doing it yourself. Or if you're adventurous like me, I just jump into sometimes, and sometimes it can be a little bad, but I am myself, and this is basically what I am. I'm a kind of a guy who likes to explore things in my own way. So that's for your travel arrangements. So one other thing when you are traveling, very important to watch for elderly people and the kids, because the elderly people has its own set of issues. They can have complications because they are not moving too much, so they can have a DVT or deep vein thrombosis, which happens when you're not moving. And so I encourage folks to get up on your aeroplane ride and every hour or so walk for a couple of minutes, come back and sit on the seat again. And with the children, I know they can have issue with the ENT, the ear, nose, throat. They can have ear aches issue. So make sure that you watch that, and certain things can be done to avoid that. Like you can give them a hard candy to suck. When you suck the eustachian tube, which get blocked with the air pressure elevation, opens up and it causes less pain. So, and plus, there can be a other noise issue. So make sure that you protect your kid. You can have the gear for your ears, or you can have earplugs, for these small kids who are not used to that heavy noise of the aeroplane. So these small simple things can actually makes your journey very pleasant and much enjoyable. Uh, one other thing which you all need to watch when you're traveling is hydration. Most of us, we don't drink enough fluid when we are traveling. Uh, but when you're traveling, you get a lot more dehydrated. One thing is, in the aeroplane ride, you get dehydrated more frequently than you can even think. Dehydration can cause a lot of problem. Just I was just few hours ago, one of my acquaintance came to me and they said, Doctor Mars, and he just almost fainted last night. And so what actually he had a heat exhaustion because coming in Arizona. So if you're going to a hot place like in Arizona or India or even China or Thailand or Vietnam or even Latin America, all these are hot places right now. You want to make sure that you keep yourself hydrated. And how much water? 8 to 10 glasses minimum, and maybe more. And if you're sweating very heavily, make sure that you put your electrolytes back. There are lots of electrolyte stuff available. I don't like those colorful, the store bought kind of stuff, but you can, get benign kind of stuff which doesn't have colors, doesn't have synthetic stuff in it, as simple as salt. If you can carry, you could carry some salt, maybe some sugar, lime and lemon, and mix it in the water and drink it. That's a nice electrolyte. You can make it yourself. So these are, very important things that you keep yourself hydrated. There are also Pedialyte or all those kind of things are available, which you can mix in water and drink it, and can give to your kids too, and especially if it's hot. And a lot of time people, when they are traveling, they're in a kind of more a vacation mood, and this is okay. Let's have some alcohol, have some beer on the plane, or wine, or coffee. So all these things will dehydrate you. You might have seen that when you drink one beer bottle, small beer bottle, you pee out 3 out. So your net balance is zero, actually negative. And same thing with the wine and coffee. So make sure that you don't drink these kind of fluid, like alcohol, beer, wine, coffee, because these are not going to help your kidneys, and you're going to pee it out, you're going to urinate it out, and you end up having a dehydration. So that's very, very important for everybody out there, that you make sure that you have enough fluid and you don't drink these kind of fluid. Yes, you can have juices, even a little bit of carbonated water is okay. I don't like sodas, especially sugary sodas. They also dehydrate you. You might have seen that when you drink a sugary soda, you actually are more thirsty after that, because that's the nature of that soda, because of sugar content in it. So the natural freshly squeezed juices are okay most of the time, but I'm a great fan of eating fruits and vegetables as it is, because that is what the Mother Nature has provided us. When we're making a juice of it, we are actually squeezing the sugar part and throwing all the best part out. So that's why I don't recommend making juices most of the time. And only one juice I recommend is pomegranate juice, because there is so much benefit out of it. And so in summer, you have lots of juicy fruits and vegetables, and like a watermelon, very nice, a lot of nitrogen stuff in it, and that nitrous oxide actually helps your blood vessels to expand and increase circulation. Same thing with the blueberries, blackberries, raspberries, cherries. All those things are really, really good for you to consume when you're traveling, if you can carry them. If you not traveling by plane, because if you're traveling within the country, this allowed, but if you're traveling across the countries, those are not allowed. But certainly you can drink more water. So I will keep the discussion going after the short break here, and we will talk about what common problems you're going to have when you are traveling. And so we will discuss the different diseases and what you can do to help that process there. So let's keep our discussion continue after the short break.
If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022.
So folks, we are talking about travel and what you need to do to help make your travel more pleasant and cut down any issues with the travel related illnesses. And one of the most common illness that people get is a diarrhea, and it's also called travel diarrhea, because of you traveling, and you can pick up different bugs. So one of the reason is, when you live in a place, it has its own set of bacteria. And when you move to a different place, there is a new set of bacteria which is present in the water, which is present in the food. So these new set of bacteria may not be very friendly to your gut flora in your tummy, in your intestines. So a lot of time people will have upset stomach, and it's one of the most common thing. But also you pick up different kind of pathogenic bugs in your food, and that can create a problem. And very common is giardia. Although Giardia is very common in Southeast Asia countries like Indian subcontinent countries and Indonesia, but it's also common right here in the USA too. Even in Eastern Washington, Giardia is very, very commonly prevalent in the streams of the rivers of Eastern Washington. So Giardia can go into a cystic form. That means it can stay there and then pop up when the environment is kind of wonderful for this one. So it can also spread, from one person to another person. So what will happen is when you get a giardia, it's also known as a backpacker diarrhea because when you traveling or you doing backpacking in the mountains, you can, if you drink water from those rivers and ponds or lakes, you can pick up and create a diarrhea there. So symptoms are usually, you have nausea, fatigue, your abdominal cramp, and non-bloody diarrhea, excessive gas, a lot of rumbling in your tummy, and bloating can occur at varying degree. And in the usually people has a rotten egg kind of taste in their mouth. So it's like my God, yucky! I have this very yucky taste in my mouth. That means you are having a giardia issue. Uh, Fever is rare; it doesn't happen very often, and the diarrhea can last, for 2 to 3 weeks, even if you don't treat it properly. So one thing is detecting giardia is not very easy. There are antigen tests available which can confirm the diagnosis, but it has its own pros and cons. The pros are that you can be antigen positive even if you don't have infection because body creates a reaction, mounted reaction, and the antigens go higher. And even if the body clears it out, you still will have the antigens high. But if you have issues, certainly needs to be looked at. So traditionally, the treatment is a tinidazole, which is a drug which is given in the dose of 2 grams per day. And there are other, like metronidazole. In older days back home, we used to use furazolidine, which is a yellowish kind of pill, and it makes your urine very yellow and your poop very yellow too. Uh, but I'm a natural doctor and Ayurvedic doctor. So what I have used and with a great success with the giardiasis. So one of the simple thing is drink a lot of fluid, keep yourself hydrated, eat light. I prescribe khichdi or you can have oatmeal. So eat light food. Take psyllium husk. Psyllium husk is amazing for almost any kind of diarrhea. One thing what it does, it swells up in your tummy, so it does not allow you to have a too liquidy stool. And it has a mechanical action. So how it works is like it is mucilaginous, means it's like a slimy. And when you eat it, it expands in your system, in your intestine, and it wraps around those bugs, the giardia or amoebas, and expel them out and make them kind of inert. So if you go on taking it for a few days, and I usually prescribe for 7 to 10 days of psyllium husk, and you can take a couple tablespoons 2 3 times a day, and it will just clean your intestine, one thing, and will wrap it up and make it. It's like you have a fish there, and you throw in the water. You throw something which is like a jello, and now fish cannot swim. So they get caught up in that mucilaginous goo, and there's become inactive and does not have any thing to do after that because it becomes completely inactive. And so very simple, easy method of getting rid of your giardia and even other amoebas and other intestinal infections too. So psyllium husk is my favorite because it's non-toxic, you cannot kill it, and it is a very easy, is available almost everywhere. Another way what I encourage my patients to do is you put in psyllium husk in yogurt. And yogurt, because why yogurt? Because yogurt has probiotic, the good natural culture in it. And so when you add yogurt and probiotics, so you're also establishing the normal flora in your intestine and getting things balanced back again. The second most common problem, especially when people travel to India or the Thailand, China, Latin America, or Vietnam, amoebas. Amoebas are very, very common. Most of the people living in that part of the continent, they are immune to it because they have been exposed to it, and people will not have issue because the body has learned how to live with it. And if you live in Bangladesh, people will have amoebas, but amoeba does not cause anything because it's so common. It's just like everywhere you go, you have amoebas. And the one thing is, water intake is very important. So I encourage people to drink bottled water or at least filtered water. Even if you boil your water for 1 to 2 minutes, that also cut down a lot of stuff. But some amoebas, which is in cystic form, is it still can go through that one. So sometimes using a filter is a 2 micron, 1 micron filter, which is available. Even REI has that, and that will cut it down further, and you will have a little more safer. So the amoebas actually causes diarrhea too. People has loose stool, cramping. People may have a fever, and in remote cases, people get abscess in the liver. Back in India, when I was practicing, I used to see few patients of liver abscess, and the symptoms are different. They don't have intestinal symptoms in those cases. Usually, you have fever, chills, and pain in the shoulder, referred in the right shoulder, tip of the right shoulder, because as the liver get inflamed, usually the infection is on the right upper dome of the liver, right below the diaphragm, and so it swells up and irritates the phrenic nerve, and that also causes coughing, and you also get a shoulder pain with it. The treatment is different for amoebic abscess. You needed to be treated a little more seriously, but the most common again is given is a tinidazole or metronidazole, and again, I'm a natural doctor, so I don't use those medication, but I'm just telling you. So again, what I will use is psyllium husk, because as I said earlier, it's going to just make it inert. It's going to just take it out of it and pull it out, and even the cysts are going to be pulled out. And then one of my favorite herb for giardia and even for amoebas is bilva. Bilva spelled is Bilva. Bilva is a fruit. It's the fruit which is very commonly found in India in months of May, June, July, August. These 3-4 months, and it is a yellowish inside. It's a very hard core outside. This is the same plant. It's called Bel Patri, which we offer to God Shiva, and because it has the three leaves, and which is a symbol of the Trishul he has in his hand. So when the bilva powder is used, and it's available even on the Amazon and even on Indian stores too, and you can take 1 teaspoon couple times a day, and it's like the effects of bilva is as good as metronidazole or tinidazole in eradicating the giardia and amoebas. So I take it prophylactically, and also I've created a formulation which is called AP Mag, which actually has all these different herbs in it and has a protective action. And I encourage people to take it around 1 capsule twice a day before they go to travel, around 10 days before, and continue to take it during your travel. And when you come back, still take 10 days after, because you can pick up the infection in the later part of your journey, and you may be all fine. And I have stories after stories. I've tried this almost in more than 3,000 patients, and all of them has come back without the amoebas, without the giardia, without the malaria, without chikungunya, dengue, all those things which we're going to talk about today. And I will tell you what I have done with my patients, so you can get also benefited from that one too. The next other common problem is cholera. Cholera is caused by a Vibrio cholerae bacteria, and it is also transmitted by contaminated food and water, and it can be also from person to person. So very common in the part of Asia, Southeast Asia again, and there was a vaccination available, but that vaccination does not work for this strain from India and Bangladesh and Pakistan kind of stuff. And again, I don't know how effective those vaccines are, because it's not available in the USA these days. So again, cholera, one of the problem with the cholera is the bacteria makes toxins, and the body wants to get rid of the toxins, so it secretes a lot of fluid. And so what happens to flush the toxins out of your system, you're making a lot of loose stools, because body wants to get rid of that toxic, because it doesn't like that toxin. And the problem is you can get dehydrated, and a lot of people die because of dehydration, and especially kids and the elderly are more easily prone to this dehydration. So one of the things which you should do is whenever you get any cholera kind of symptom, you want to make sure that you're drinking enough fluid. And I usually encourage people to make an oral hydration solution, which is like a Pedialyte or electrolyte solution. And if you don't have access to that one, you can make your own. Almost sugar, salt, baking soda is available almost everywhere. So you can take a one tablespoon of sugar, and you can put around half teaspoon of salt in it, maybe quarter teaspoon of baking soda, lime, lemon. You can put the orange if you want, and put in around 2 glasses of water, and keep giving that person every half hour 1 to 2 glasses, every half hour 1 to 2 glasses. And what you will do, you keep your hydration up, and you keep flushing the bacteria and then the toxins, and your system will be better. The treatment again, you will give psyllium husk, because psyllium husk, as I said, it goes inside, it actually absorbs the toxins, pull it out. Activated charcoal is another thing which can be given, and it's available all over the places, even from the health food stores too. It's available in USA. You can carry that, because as you know, charcoal is a wonderful filter for absorbing a lot of toxins. Medically, we give activated charcoal for absorbing a lot of different kind of toxins, are poisons. So it's again non-toxic. It can kill you, and you can even take an overdose of it. It's still safe. And usually, if you have problem, I encourage people to take 4 to 6 capsules of it, 3-4 times a day, along with psyllium husk and probiotic, and that should help it. And usually, these are self-limiting kind of infections. If you keep watching your hydration and keep flushing your system, you'll be pretty safe. But if you get dehydrated enough that you're not seeing it, you need to seek immediate attention, medical attention. IV fluids needs to be given. So make sure that you don't go into that phase. But if you keep your oral hydration system going, you'll be pretty okay. Let's have a short break here, and we'll continue our discussion, and we'll talk about the typhoid fever next after the short break.
If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchakarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchakarma treatments at 425-453-8022. That's 425-453-8022.
So folks, this is Dr. Virender Sodhi, and we are talking about travel-related diseases and how you can be safer and avoid these diseases, what you need to do to prevent these things. I'm giving you certain tips which I've used over now 30 plus years since I moved to USA, and these tips which I'm giving you worked almost 100% on almost all my patients if you follow the direction which I'm giving to you. So one other common problem when you travel to countries like India is a typhoid. Typhoid is due to a bacteria called Salmonella. Salmonella is very common in USA too, by the way, but somehow I think maybe there's a different genomic pattern to it. We may not be as prone to it unless your system is weak. But typhoid can be fatal if it's not treated properly. So very common in Chile, Haiti, Nigeria, India, Pakistan, Southeast Asia, Indonesia, Bangladesh, all those countries very heavily have issues with typhoid because Salmonella is very common, and it's spread through the oral route and through the food and water. And so usually people get loss of appetite, fever, and the fever are waxing and waning as the day goes. The fever progresses, then it's lower in the morning time. And there used to be a test called Vidal test back home. We used to do that to make diagnosis. These days we have a little more sophisticated tests available. Sometimes there is a rash appears on the chest and the abdomen area, which is around 2 to 4 millimeter small rash, and that's another very peculiar of typhoid fever. and diarrhea is almost in 50% of the patient you have diarrhea. And personally, I have suffered typhoid at a young age. I think I was in 8th grade twice in that 1 year, and now I understand why we had it, because we used to have chickens, and I used to pick up the eggs and from my hands, and they will be poop off those chickens, and I didn't care to wash my hands. I think that's how I picked up salmonella. So again, the traditional treatment is antibiotic, and there's a combination of sulfur drug, which is called trimethoprim and sulfamethoxazole are given. Previously, we used chlorophenicol, which is kind of a very toxic antibiotic. Ampicillin is given. Cephalosporins are given. But again, then the other one is the quinolones, which is given. Azithromycin is also given. Ciprofloxacin are very effective in treating it. But what I done again is I will use psyllium husk. Again, it works mechanically. It goes inside and kind of bind onto those, makes those bacteria inactive, because they can't swim anymore. They can't be very active, and they are very prevalent in the intestinal walls in there. So it's going to flush it out. Activated charcoal absorbs stuff out of them, and they become inactive. So this is a simple, easier method of killing typhoid salmonella. What works like a charm on the typhoid is turmeric, the spiced turmeric, the yellow curry powder. So you can start taking the extract of turmeric, which is called curcumin, which is the yellow pigments in that turmeric. And I encourage people to take around 500 milligram capsule before they go to the trip, one capsule twice a day. So this curcumin is not very bioavailable. What that means, it does not absorb in your system. So it stays in your intestine. So the infection of salmonella is in the intestine. So it's really good for that. So if you take it, you are going to cut down the effects of salmonella. Even if you got infected, your body's going to have no impact with it, because it is that effective. And you can also cut it down by adding turmeric to your food. But most of the time what we do, we cook with turmeric. When we cook with the turmeric, we are destroying the effects of turmeric. We are making it inert. We are not making it more helpful. Actually, all the bioflavonoids are fried down, and what we have is nothing left in that spice. And so you may be thinking you're taking turmeric, but you're not taking turmeric. You're actually causing your turmeric to die because of the frying or roasting, whatever you do. So curcumin, the yellow pigment in the turmeric are very effective. You can take around 500 milligram capsule twice a day, again prophylactically 10 days before you go, and continue during your trip, along with your probiotics. Probiotics are essential for almost all the GI things, and I recommend probiotic 100 billion, and you take one capsule 2 times a day, morning and evening before meals, because probiotic, you want to establish the flora before you start your meals. So another common infection is which is commonly called bacillary dysentery or shigellosis. So bacillary dysentery is caused by the infection with the Shigella species bacteria, and this is actually more common type of diarrhea all over the world. Around up to 40% diarrhea of the world is because of the shigellosis kind of species of the bacteria. And then there are other ones too which can cause like a Campylobacter and Yersinia, but the shigellosis counts the heaviest, around 40%. And again, the treatment is antibiotic. Usually the tetracyclines are given, furazolidine or sulfur drugs combination, trimethoprim, sulfamethoxazoles are given, azithromycin is also given. Again, my treatment is the same. I will give curcumin, I will give Bilva, probiotic, psyllium husk. You will clean it out. So prophylactically, you can take curcumin capsules, 500 milligram, one capsule, and probiotic twice a day. So if you take that, you will see almost all these diseases which we talked so far, you're preventing it. And I have, as I said, around more than 3,000 patients which has gone to these countries over the 30 plus years time since I've been practicing in Bellevue. None of them has come back has problem. I had one very interesting incident, which has happened with me too, because when I travel, I always take these protocols. and my wife and my kids take it, and we always come back without any problem. And whenever somebody else who doesn't follow the protocol have the issues. We had a patient who went to Egypt for River Nile excursion, and there was 14 in that party, and one of them was my patient, and he took my protocol, and out of 14, 13 was puking, has a bad diarrhea, except for one patient, and he was following my protocol. And interestingly, they all had these antibiotics and they have taken vaccinations and stuff. They still got into the trouble. So I think you can see that how effective these protocols are, and it can really make a huge difference there. And if you follow it properly there. So then let's talk about some other issues which you can have when you are traveling. Tuberculosis is very common in India and Europe and in China, and especially where people has a small houses and there is a less ventilation, and the bacteria can is spread by droplet infection. What that means, when you cough, when you sneeze, you are throwing bacteria out, which is surrounded by a kind of a mucus, and then you inhale that one and you can get the infection. Almost everybody out there in India has been exposed to it, and if you get exposed to it initially, the body will make a reaction, and you get a little fever. You may not even notice it. You may have a little runny nose, a little bit maybe cough or something, but then body kicks in and take care of it. So, but if you have when you're visiting and somebody is coughing and constantly coughing, and you see that there's something of different, you need to be cautious and make sure that you get checked out. And usually you can do a chest X-ray to see. You can do a blood test. There is now the PCR test available, which you can diagnose very quickly. And the treatment actually is antibiotic, combination of antibiotic, and prophylactically isoniazid is given. And but in our time, in the older time, I worked in the TB hospital for 3 years. There used to be 3 drug regimen. Now there's a 2 drug regimen, 1 drug regimen. But I think prevention is the key here, and especially if you're traveling to Soviet Union, Europe, and India, those countries has high prevalence. This is just for attention there. So make sure that you keep in mind, especially somebody who's coughing and you're getting exposed to it. Make sure you ask the history. Does he have any tuberculosis? I've been treated. If he's treated, usually within few weeks he is bacteria free, so he's not spreading the disease anymore. So we'll continue our discussion after the short break again, and we'll talk about another interesting part of the travel. When you travel, you can pick up parasites, and parasites can be really an interesting subject, and there are lots of them, but I cannot discuss everything. But I'm going to cover some main ones here, and I will also tell you some interesting incident which happened with me, and that's how I actually developed the product AP Mag to prevent myself and my patient from the parasitic infestation. So we'll come back after the short break here.
Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022.
So folks, this is Dr. Sodhi, and you're listening to Your Body is a Natural Pharmacy, where I teach you that your body has everything in it to make all the wonderful drugs you need to, but what you need to do is follow the simple laws of Mother Nature, eat healthy, breathe, do your yoga, do your breathing exercise, and drink good water and have a good sleep. Just yesterday, there was a interesting study which was published. People who were taking, who had breast cancer, I'm just talking about the sleep here, and who were given drug like anastrozole, which is the estrogen blocker drug, or aromatase inhibitor drugs, and tamoxifen, the people who got a good sleep, they had better results than those drugs. So you can see the sleep is a wonderful, wonderful, really, really a very, very amazing, stuff which you can sleep can promote in you. So this is actually, I think, very wonderful for you to consider good quality sleep. But I will come to the sleep, because sleep is also an issue when you travel. uh, so the parasites, we very common, because again, when you live in that place, you somehow body get immune to it. But when you're traveling, is you get more kind of tasty meal for those things. They say, okay, God, we got a new kid in the block, let's infest it. One of the very common is roundworm, which is called ascariasis. Uh, as scary as the name is, but this is the kind of round, long worms, and they look like almost like a earthworms. And so they produce a lot of eggs, and the human passes in the feces, and then they incubate, and then people become infected again. So this is kind of a it's spread through the contaminated food and water, and they enter the intestinal tract and hatch larvae, then penetrate gut wall and carried back to the lungs, and people can cough up. I've seen patients where they have coughed up hundreds and hundreds of these larvae from their coughing and from the nose. The bugs just like dropping in hundreds from the nose. And one time, back in India when I was practicing, one kid was brought to me who was 5 years old, who has intractable vomiting. This vomiting will not stop. He was hospitalized for 5 6 days. He still continuously, they were constantly giving him fluid, and they came out of the hospital, the vomiting stopped and then started again. And they brought to me. So I was checking him, and I was just like doing the full exam. And when I put my tongue depressor in the mouth and shine the light, and there's something like a snake coming out of the mouth, and so, whoa, what is that? I was actually, I was scared. I said, what is that? Then again I put the tongue depressor and I shine the light. This is this there's a snake kind of stuff coming out of the mouth. So I said, oh my God, this is a roundworm. And so what I did, I took a little anesthetic, sprayed in the throat, and then asked my assistant to do a hold on the tongue depressor, and he took a artery forceps and pulled out. There was around 8 inches long roundworm which was stuck in that food pipe there and was causing vomiting and the unstoppable vomiting. And once I took that out, the vomiting stopped. And I treated him for the roundworm, and he was a happy camper after that. So very common infection, by the way. And the drugs which is given is bendazole or mebendazole. But I have, as I said, I have made a product called APMAG, which is an antiparasitic formulation with the herbs, as I'm a herbal doctor. And we have so far very good success. And actually, I made this formula because once I went to India, I think it's maybe around 25 plus years ago, I came back, and I passed out this worm in my stool, and I was, oh my God, it was around 1 feet long. The female is longer than a male, and it was a lot of cramping in my tummy. And then I developed this formula to help with the parasites. So I made it a kind of broad spectrum, so it can be covered many different parasites in there. So the another one which is very common is a hookworm. Hookworms are kind of you get it through walking barefoot. If you're walking in the grass, and they can penetrate through the broken skin from the foot, pass through the lungs, and end up in intestine. And they suck in your blood and causes a lot of anemia. This is the common symptom. People can have coughing, wheezing, and because a lot of allergic cells develop in the body, almost with all kind of parasites in the body, and a lot of people has a cough. So one of the other method, we check it, how much allergic cells, the eosinophils you have in your body, in your white cell count. If you have a high amount of eosinophils, you are going to also check it for if you have a parasitic infestation. So the again, I give this formula, antiparasitic formula, and you take it one capsule twice a day. and you continue. You start before you travel 10 days before, and you continue through the travel and come back, and you still continue 10 days after. So this will cover your broad spectrum stuff in there. Uh, the another one which is very common is whipworms, these are they can live in your body for many years, up to 7 years, and can lay thousands of eggs. And people get abdominal pain, chronic diarrhea, rectal itching is very common, and in kids it can actually even stunt the growth of it. And so again, they need to be treated. And one other thing for the especially for the whipworm is the vegetable bitter melon or karela works like a charm. So that's how I figured it out. Like people will eat karela back in India. The vegetable is eaten commonly, and next day they will come in and say, Dr. Sodhi, my God, my stool was full of these bugs. And they will, usually in those days there was no camera kind of stuff like now. It's funny that people will take a shoot from their cell phone and bring the pictures of that one. Of course, not very pretty pictures, but they used to bring those parasites in a cup and says, God, look at that one. And those were whipworms. And so later on, I start putting two and two together. Whenever people ate the bitter melon, they will have, if they have a worm infestation with the whipworm, they will die in thousands of it. So that's why I put bitter melon in this the anti-parasitic preparation, and that has become a really very effective. And people will come and say, oh, I had these parasites in my stool, and I said, did you eat bitter melon? And they thought that I have a little psychic, I can see what they were eating, and they will get very astonished. But because of my observation, eating bitter melon and passing out the whipworm was very, my observation, and which actually become a medicine afterward. So those are another one very common infection which you can pick it up. Another one which you pick it up is which is called strongyloidosis. Again, long name, strongyloidosis. The larvae can enter through the skin and pass through the lungs and enter the intestine. And so again, the people has they will get a lot of symptoms, especially diarrhea, coughing. The symptoms of almost all parasites are very similar. So sometimes it's difficult to find unless you do the testing which one is which. And unfortunately, a lot of lab in the USA does not know how to check the parasitology because they don't have a good tropical medicine training, and they don't see patient, and so they don't have the diagnosis. I've seen so many patients who has traveled to China and India and Thailand, Vietnam, and all those countries, and come back and have unknown disease, and they have been gone to university hospitals and have not figured it out, and until they come to me and says, oh, you have parasite. And it's a parasite. Yes, you have a parasite. And once we treat them within 2-3 weeks, their symptoms improve. They feel much better. So you can see that our a lot of doctors are not very well trained for tropical diseases. The another one which is very common, especially, is tapeworm. And the tapeworm we actually even get in USA here too. There are two types of tapeworm which are very common. One is a beef tapeworm and one is the pork tapeworm. Usually meat in America is very inspected properly, so you don't see it more often. Pork tapeworm, same thing, But in the third world countries, if you're traveling, especially the countries like where they eat a lot of pork, like China and Vietnam and Thailand, you may be exposed to it because the controls are not as good as we have over here. But even there are cases of beef tapeworm and pork tapeworm in America too, and this is not fun. When you have these, I've seen patients where these tapeworms has penetrated the brain and has created a problem. People got psychosis. People got sick with it. So whenever you eat these kind of meat, and if you well cook, even they have worms in it. If it's well cooked meat, this destroys it. So cooking nicely is good. And the like Indian style, when they pressure cooker put it in the cooker, pressure cooker is very effective because it kills almost all those tapeworms with the cooking. But when you broil or you semi cook it or you eat raw, that does not make it better. For the tapeworm, the best thing to do is betel nut. The betel nut, which is chewed in India, the powder of betel nut works like a charm on these tapeworm. Recently, I saw a patient who has been to a marriage party in Myanmar, Burma, and she came and she's passing out these white strips in her stool. And I said, that's a tapeworm. And she brought the picture of that one. I said, that's a tapeworm. It's a tapeworm. How did I got tapeworm? I said, I don't know. Did you eat any pork there when you were visiting? I said, yeah, I ate pork there. And so that's how she picked it up. And again, the treatment is a bendazole or praziquantel, which is a drug which is given. But I have seen equal benefit by using betel nut powder. And usually I treat them for 1 to 3 months. I don't just give for 7-10 days. And that makes sure, because a lot of these parasites have cycles. So you can kill the live stuff there, but the eggs can still stay in the whole body and can kind of create a problem again. Then less common is or like a rabies. There is a rabies vaccination which is available, and especially if you're going to countries like Nepal, India, where there are stray dogs, and some of them can be infected, and it's actually spread by bats and foxes and skunks in the USA too. So there is a possibility. It's a kind of rare kind of possibility, but not very common kind of possibility. If there is a concern, the thing it should be you should get vaccinated for rabies before you go. And usually, I think there's a 2 rabies vaccination is given, which gives you immunity for the rest of your life. Although I'm not a big vaccination fan, and but I think rabies is one of them, which I will certainly do it if I'm going to infested area where there is rabies cases has been noticed. The another thing which you should watch for is the fish poisoning, and the Seguteria poisoning, which is a coral fish, is very common. It causes problem. And there is also a puffer fish, which is eat in Japan, is a problem too. And then the shellfish, usually the oysters, mussels, and clams and scallops, they can also cause the poisoning. So avoid those kind of things when you're going out, because you don't know what can happen with that stuff. So I will certainly not eat those kind of fish when you are traveling out of the country there. So folks, then there are other diseases which are born with the mosquito or bug bites. Malaria is very common, chikungunya is very common, dengue fever is very common. So my herb for this is neem. Neem is a prophylactic, and if you can take around 500 milligrams twice a day, don't take it empty stomach, take it with the food, because it can lower your blood sugar. And so when you take neem, it actually not only provide you benefit from these malaria, chikungunya, and dengue fever, but also you get less bug bites. There is a studies been done where people were taking the neem, and they were not very attractive to these bugs. So you are actually having a kind of repellent action. And a lot of time people are asked to use DEET, which is a very neurotoxic stuff, and I don't like that. If I have to use it, I will use rather lemongrass, which is equally and less toxic. But sometimes even lemongrass smell is too overpowering and it can bother me. But neem is pretty safe, and you can use it, and commonly make it in the capsule form, and even the kids can also take it in liquid form too, and you will have a good benefit. So then last, I think there is only 1 minute left in my talk here. Anxiety and stress and sleep. So ashwagandha is my go-to herb, and melatonin. What you can do with this, when you're traveling, you have a jet lag, so you can see the sun, close your eyes, see the sun, close your eyes. Just reset your pineal gland, and you reorient you to that place. So ashwagandha can be taken 1 capsule twice a day for anxiety, stress, and insomnia, and stress reduction. And also, if you have an issue with the sleep, you can increase it to maybe 2 capsules, 3 capsules, 4 capsules, 6 capsules. I've given 6 capsules of ashwagandha 3 times a day. So folks, these are the tips which I gave you today. I hope you enjoyed it. And if you have any questions, give us a call. We will be very happy to share our protocol with you. And we can tell you what I use for this stuff.